So my name is Jing Huang. I'm an assistant professor of biostatistics at the University of Pennsylvania. The work I'm going to present is a joint work with our COVID lab team, research team. We are a group of biostatisticians, doctors, and data scientists from the University of Pennsylvania and the Children's Hospital of Philadelphia. So let's jump right into what we did. So what we did was we studied the associations between county-level factors and COVID-19 transmission. And also we built a county-level prediction model to project the disease transmission across the United States. So we are doing it specifically we're doing at the county level because we have seen that different counties in the United States went through a different experience throughout this outbreak. So overall, we wanted to monitor the propagation of pandemic to understand the resurgence risk and try to assist decision making. And there are many models and projections that have been proposed. For example, the very early HINE model. And we felt that many models have been providing country level or state level estimation or projection, but few of them have been really nailed down to the local area effect. But if we think about a single person individual, when I was reading the newspaper, what happens now in New York City may be not very relevant to what is happening right now in Texas. So as an individual, I really would like to know what is happening around me, in my county, in my neighborhood. And from the policymakers' perspective, when making different policies to contain the disease, we need to balance between economics and also the effectiveness of that policy, but also we want to take into consideration of the culture and the county level characteristics, trying to optimize the policy. So given that motivation, we focused on mainly two things. One thing is trying to understand the dynamics of the disease transmission, which is how that disease transmission is changing over time. And second, we would like to understand, is there any county level or local area factors that are associated with this change of disease transmission? Is there any factors that is modifiable so that we can make some policies based on that, trying to contain the disease? So to model the disease of transmission, there are many existing models. The most famous and commonly used model is the SIR model or the SEIR model. So this is a component model has been proposed a long time ago. And the idea is trying to divide the whole population to different components, including the susceptible population, infected population, and also the recovered population. And how this disease transmitted occurs also depends on how the flows between these groups. And by the definition, these flows can be estimated or quantified by the partial derivative equation. So to understand the transmission rate or recovery rate that is defining the SIR model, what we really need to do is trying to solve a bunch of partial derivative equations. So this model, as we see here, this model does not involve any time components here. So overall, when we doing the estimate, using this model, we will get a static estimation of what is happening currently. Very recently, a group from Taiwan, they have proposed a time varying extension of the SIR model. The idea is to model every component as a time varying part, including those the transmission rate and the recovery rate. So this becomes a time varying SIR model. And again, still this is based on the SIR model framework. again, the challenge is here is to solve this partial derivative equations, and due to this time varying component, it may involve more computation burden, more mathematical calculation here. So another very commonly used matrix to measure the disease transmission is the reproduction number. The reproduction number is related to the ratio of the transmission rate and versus recovery rate. So there are different versions of definition of the reproduction number. The basic reproduction number is, can be considered as the expected number of cases that can be directly generated from one case in the population. So in epidemiology studies, when a disease outbreak is over, people will go back and retrospectively to study to estimate the basic reproduction number, which may capture the behavior of the virus. So we know that when the when the reproduction number is under 1, the disease can be has the potential to be contained. But when we are during the outbreak, this reproduction number is changing every time, and in different locations. Potentially, they could be different in different locations depending on that local area effect. So there is another definition called the instantaneous reproduction number, RT. So this RT is defined, this instantaneous reproduction number, the definition is related to the number of daily instance only, condition on what the number of instance in the previous days. So this is a much simplified model, which only involves the daily instance. So as the definition here is, given, for example, we are looking at time t, the t state, and the new instance that can be observed today, they are generated from the existing cases that was infected in previous days. And we assume that this daily instance, IT, follows a Poisson distribution with, depending on the instantaneous reproduction number and the weighted sum of previous day's instance. And the weights that used to calculate the weighted sum can be considered as, for example, the contingentness of a case, and given that the case has been infected for how many days. It also reflects that pathogen progression or generation, that changing in a person's body over time. So this model is much simplified, as we see here, and because it incorporates the probability model here, it can better allow us to incorporate the modeling of uncertainty and randomness. And also, they can be easily to integrate with other statistical models, for example, measurement error models and regression framework. So based on this framework of instantaneous reproduction number, IT, what we did is we incorporate this RT with a regression framework to understand what is the association of factors and with the disease transmission quantified by this RT. So there's multiple ways we can do this. A very simple strategy is just to do a two-step procedure. We can first estimate the RT using the data instance. And then based on that estimate RT, we can regress that on the factor, the covariance of interest. And the other option is that we can jointly model both data instance quantified by this RT, and also the association between those factors and the RT. So in this talk, I've been focused on the first two-step procedure. There's another talk given by Dr. Jiashan Shi in this morning's session B presentation, talking about how we propose a semi-parametric model to jointly model the association and also the dynamics of RT. So for this work, we use the two-step procedure. We model the association And based on that understanding, we project the future transmission. So when we model association,
5-minute warning.
sure, we start from 200 counties, and our mainly exposure as social distancing measured by percentage change in visit to non-essential business, and also population density and temperature. And our major outcome is that daily case and or the reproduction number estimate from that daily case. We also consider other covariates that can potentially affect disease transmission. So this is what we found. We found that social distancing, population density, and temperature all have very important impact on the disease transmission. And of all these three, social distancing has the most strongest effect. And if you see this simple plot here, the black dot here shows that social distancing measure from February to late April. And we see there's a huge drop during early March. That's when the time the United States closed school, closed business. And the blue line shows the average RT, instantaneous reproduction number. We superimpose both measure, and we see that they are very highly correlated. And the second factor we see here is the temperature. It's quite a controversial question here. And when we study the temperature, we use a distributed lag nonlinear mixed effect model from one of our team members. And specifically, we see that when temperature starts to increase from negative value to 10 Celsius degree, the disease transmission slows down. But when this temperature reach upper than 10 Celsius degree, that potentially the transmission can goes back. It could be due to that there are other human behavior, changing human behavior related to that temperature increase that was not captured in our model. And also we see population density as is a risk factor as well. So more dense counties can have a higher RT given the same temperature and social distancing. And based on this understanding, we try to project what is going on in the next future using the historical temperature and some assumed value on social distancing. Because the US we have went through the staged reopening strategy, right? We want to understand whether in which stage is more safe right now for to control the disease transmission. So to build the prediction model, we incorporate a time series autoregressive model from time series data analysis to make the prediction more accurate. And we have been, this is example output of our projection. So we predict the reproduction number in next few weeks. And then based on that, we project the daily cases given the existing cases in the population. And this blue line is what we project in mid-June. And this red line is the actual reporting number during that period. So we have been projecting a similar uptake in Texas and Florida and Los Angeles in mid-June. Another advantage of using this regression strategy to understand our disease transmission is that we can, based on different scenarios, we can project what will be looks like if we use a different policy strategy to contain the virus. So for Maricopa, during early July, we see that since they already have large cases in the population, going through phase 2 may not be very helpful. They probably need a more stringent policy to contain the virus. 1 minute. Sure. And just to give you what we got, the data resource we got data from USA Facts, the NOAA, the UNICAST that provide the social distancing data, and we also have the testing data from HHS. So the single message I have is everywhere is different. We have to focus on local area effects to have a better understanding of disease transmission. And I would like to share some of my thoughts on working on this project. I feel this is a very challenging project to work on. And at first, we thought we were working on building blocks, but in the reality, we are actually trying to disentangle a huge mass. Data quality a big issue, a lot of measurement errors, reporting issue, testing capacity, all these affect our results. And also we found that when we have a message, it's very challenging in terms of how to deliver this message to the public media. It's much more challenging than talking to Greek letters. So there's a long, still this is hasn't ended yet. We are still working on this project, now we're trying to work on like different questions, how to open school safely, how can we run through the winter.
You are over time.
Yeah, I'm happy to take questions.
All right. I don't think we have time for it, but thank you very much, Dr. Huang. And wait, William Radcliffe really quickly asked, will your slides be available?
Sure, I'd be happy to share.
Excellent. Thank you very much, Dr. Huang.